today is your memory and a cognitive little test. She will do that, Jessica will do that individually with you. Don't be embarrassed.
It's not a bad test.
It's not a bad test.
And there's no failing it either.
That's
so.
right. So
yeah.
Jessica, take us away.
All right, I'm Jessica Eubanks. I'm one of the nurses with Theta Care at Home. And I just wanted to come today, talk a little bit about memory screen. The test I have today is called a mini mental exam. It's used in your doctor's office. Nurses can perform it. It's a standardized test that just kind of asks some questions to see where your memory's at. And it's a good indicator of if you're having some of that memory loss, or if you already have memory loss, you know you have memory loss, where you're at in that progression of memory loss. This should always be, if you do see that there is some memory loss, you should always follow up with your physician, because they then can go into a much more comprehensive exam, find out what is the cause of memory loss. Is it, Terry has too much on her plate and she just forgot about the date, or is it, something, a disease process. You hear a lot about Alzheimer's, and then dementia. There's actually many, many different forms of dementia. Alzheimer's is just one set. Then there's Lewy body dementia, there's dementia from Parkinson's, there's the list can go on. So really understanding what is the root cause of the memory loss is really important. Sometimes it can just even be something that's treatable with medications and things, and the earlier you detect it and the sooner you start on medications, the better your prognosis is, because even now they have meds that can slow down Alzheimer's and Lewy body dementia and things like that as well, to just kind of help with that. And when you identify a problem, you can do other things other than meds to help strengthen your memory. There's little quizzes that you can give yourself, staying active, reading, all of those things are really important in trying to keep your mind sharp and keep you going. So a little bit more into the mini mental exam today. If you want to take that, it's just a few questions. The score is up to 30, so 30 is you got everything right, you were spot on. And to be honest, I don't even get a 30 because I can't do math that well, so there's some math questions on it. So don't feel bad if you don't get a perfect score. But anything 27 or above is considered you're normal, you're good. Anything between like 19 and 24, we're starting to say, maybe is this an off day, or are you starting to have some really early signs of some memory loss? And then anything in that 10 to 18 range, we're saying, okay, there's definitely a problem here, and we want to look into this further. Anything below that, we already know you have a problem. It's probably just more of a diagnostic test for where you're at, and you probably already have a diagnosis. So these quizzes, I'll give, if you do decide to take it, we'll go out to the little table by the books. We can go over it. It only takes probably about 5 to 10 minutes. If you have questions afterwards, I'd be more than happy to answer any questions that you have. But the quiz, you get it back, it's yours. And that information is just for you. It's not shared with anybody else. I don't go to anybody to tell them that, hey, so-and-so got a score of this or anything like that. It would just be yours to keep and to do with what you will, if, recommendations and that if you would want to follow up with your physician would be kind of your follow-up for that. So it's not bad. It's kind of fun.
Did I read somewhere that they've found some a new gene or something they think is in Australia or someplace that they think might be an Alzheimer's?
There's always the talk about the genetics behind it, and they have found that familiar history. So if your parents have it, you're more likely to get it. But some people that don't even have any family history of it can also get Alzheimer's as well. So it's really a lot of research is going into it. The vitamin deficiencies as well have been shown to have some correlation with some dementias. There's a vitamin B12 deficiency, if it's severe enough and prolonged enough, can cause dementia-like symptoms, and so there's a lot of research going into all those.
Well, can you tell us what the main kind of causes of dementia or Alzheimer's are? Is there such a list, or is it just so broad?
It's very broad, but more genetic. They really look into that, and I guess the best thing that you can do for prevention is to be aware and to go and see your physician early on. People will wait until they see really noticeable changes, forgetting to turn off a stove, or accidental fires, and they wait till it's very, very far progressed before they seek any treatment. And at that point, some of the meds that could have been used and some of those the memory skills kind of thing, it's already beyond that point. And so catching it early and not being afraid to look at it and do exams like this and come to events like this, and it's really important. So,
and kind of on that note, I want to bring up that we're starting a memory cafe here on the 4th Friday of each month. Now, they did, this has been going on in the UK for years, and the government actually funds their memory cafes. That doesn't happen, of course, in the United States, and so they're encouraging grassroots starting, people doing it on their own. And I talked to our caregiver coalition, and many people you guys have offered to help. But what it is when you come, it's for early stage, maybe dementia or Alzheimer's with their caregivers, and people that maybe you find out in your test that you have a few problems. We're going to be offering starting with puzzles and fill in the phrase or finish the phrase. We're going to have memory talks. It's supposed to be fun and social, but it's also to encourage us to use our brains. Then, if there are people that are caregivers, we can share information with them of resources. But like you said, to do the stimulation and the puzzles and stuff seems to be the most important.
Absolutely. If you don't use it, you lose it. So keeping your mind sharp and doing what you can, reading, puzzles, that is excellent that we have programs available, and not being afraid to participate in things like that. And
At the time you're a caregiver, it's almost too late already for Alzheimer's. And how do you know ahead of time that you got Alzheimer's?
Well, hopefully, tests like this mini mental exam will kind of give you an idea of where you're at. And so even if you notice that your score is just in that mild range, that's a time when you can really start working on some of these things before it gets too bad, before you really have lost a lot of function and cognitive abilities. So, and noticing just in yourself, how if you are forgetting things, and being open and willing to talk about those with your doctor is the best way, because then your physician can really do an in-depth exam and keep an eye on that.
Do you suggest they start with their general physician or a gerontologist?
Family practice,
Okay.
whoever your internal medicine doc is, they're all trained in how to perform these and how to look at that. And then if they notice that there is an issue, they might refer on to a gerontologist or a neurologist or some other specialist. But starting out, just start with your family practice or internal medicine doc.
You don't really want to address it yourself because you yourself do not want to know that you maybe have it.
Right, it takes courage. It really does. It takes a lot of courage, and I think there's courage here that you guys are even, listening and participating in something like this. So it does take,
You said Parkinson's disease is a part of dementia?
Right, there is a dementia that is specifically related to Parkinson's. It doesn't necessarily mean just because you have Parkinson's that you're always going to get this dementia, but there is one that is specific to Parkinson's that are linked.
How do you find that out?
That again, you'd have to go to your physician and you'd have to have that discussion with them as well about they're going to ask you a lot of similar questions that are on the mini mental, and taking this to your physician, having this already pre-done is a great first step because then they don't have to repeat all these same things, so then you'll have it done already.
I've got Parkinson's, but my physician doesn't want to give me no pills yet because they said it's not far enough advanced.
Right, and that's it's probably, that's a good thing. It's a good thing.
Jessica, could you talk about like UTI? Sometimes a UTI can cause it, and you don't want someone to think they have dementia, Alzheimer's, but they might have some symptoms.
Right. Especially if you see all of a sudden a really quick onset of confusion, memory loss, where it wasn't there before, and it could even occur over just a couple days. It could be a urinary tract infection or some other type of infection, or just illness. Getting really dehydrated can cause some of those confusion issues as well. So if you see any of that, that's why it's so important to go to your physician right away, especially if it's that sudden acute onset, because it could be something as simple as a urinary tract infection, which is really common to occur, and can really be quickly treated with an antibiotic, and the turnaround for that, they'll be back to themselves in just a couple days after the antibiotic is started. So,
do you know whether there are any studies that deal with the power of suggestion when it comes to memory loss? Specifically, if you keep saying, oh my goodness, I just can't remember that person's name, I'm never any good at remembering names. If that does, as power of suggestion, tell your brain that you are going to have trouble remembering names.
I don't know of any specific studies on that actually. It's kind of interesting though to think about of what are we telling ourselves and what are we, limiting ourselves to when we do that. Of course, we have a lot of control over how we perceive ourselves. So, but I don't know of any studies specifically on that.
Well, I would think they say that if you're sick or undergoing cancer treatment, the more positive you are about it, the more likely you are to succeed in your treatment. And that I would almost think that has to have something the same as what you're saying, that if you...
The power of positive
Yeah.
Yep.
Yeah, I would think that, I've
I'm
never
just
thought
curious
of it,
whether
but
there's-
that's a very good point.
Well, I've heard, I've got kind of a way out friend there who says, every time you say that you can't remember something, you're telling your brain you can't remember something. And I mean, there are plenty of studies in marketing and so forth that have to do with the power of messaging.
Sure.
And I'm just curious whether you had heard of anything having to do with
and
memory.
I can see how it would be a difficult study to do scientifically, as well, because it's so subjective. But no, I don't know of any studies offhand that.
We should get a grant and
That
do
would be,
it. Yeah.
oh, but to set up a study like that, what would
Yeah.
your tools be to?
Exactly.
What's the instrument?
Yeah, that's what, you can't measure it.
You could call the colleges and see if they have any going like UW-Madison, you never know. They have so
Yeah,
many
good
studies and
point.
things going constantly, and they have the students come in and different people come in, they pay them to do these studies, and they come in every so often.
Well, and you should come, this was interesting, we just talked about this yesterday, was there, the Alzheimer's walk, you know, we do one in Waupaca, and, you know, monies are used to, study Alzheimer's, and they have a person here that day that asks if you wanna be in, the trials, and they're done out of Madison and Milwaukee, and they want healthy brains, or what are perceived as healthy brains. So you sign up for these, they pay all your expenses if you have to go to Madison or Milwaukee. They'll pay for your overnight stay, your travel. They don't give you medications, sometimes you can just do it by phone. But, and maybe, you know, that's a component of their trial, who knows?
Sure.
But, you know, I've been thinking about doing it, that if you can do it, you know, help somebody else by,
How far along, can you be
you know,
before you can get in that trial?
well, they want it everywhere from healthy brain to people with Alzheimer's.
Well, what about Alzheimer's that are pretty bad? Can't walk, babies can't even feed themselves?
I'm not sure that then, that's where they want, what they're looking for. Maybe they're looking for more of a prevention at that point. I don't think you can't reverse the,
Will they accept you if you're that far along?
Probably not.
probably not, but you, I mean, it certainly never hurts to ask.
And there might be other trials.
Yeah, there might be other trials that they would, but,
Because my family doctor thought that, see, my wife's got Alzheimer's in Bethany, and I found out my doctor is in London, so can't have him anymore, but he thought she would be further along, but seems to be coping with it.
Kinda
Sometimes I
stable.
don't even think she's got it. But she can't walk.
yeah, I don't know.
When is the walk?
The walk is, in September. I think the second Saturday in September. Sorry, we kinda got off track there, but I mean, you know, these are all, yeah, yeah, to share is, you know, to get more knowledge. Because they can look at your brain, a neurologist, and see the Alzheimer's in there, right?
Yep, now some of the dementias, it's not until afterwards you have to get an autopsy to determine exactly what kind, like the Lewy body and that sort of thing. But upon autopsy, they can tell you exactly what it was that was going on, because there is definite changes, in the brain structure, the actual, neurons between the brain cells and stuff, they twist and start to kind of decay. It kind of becomes this black mushiness to it, and so there's definite structural damage that occurs too with some of these. And depending on the type of dementia, they all look different when they do the pathology on those. So.
But they wouldn't see it now if they did a.
They wouldn't be able. They would see that there was something going on in the brain, but exactly what type, they're not going to be able to tell you. They can, based on kind of the behaviors and the cognitive function and that sort of thing, they can kind of tell you about what it is. And you know, with the Parkinson's, if you already have a Parkinson's diagnosis, they're probably going to say, okay, it's probably Parkinson's dementia. But it's not until afterwards, with an autopsy, that they can really say, yep, it is for sure this,
Right.
or it isn't. But at that point, most people don't really care. So.
Autopsy, you say, but most people won't think alive that I want my body played with after I'm dead.
Yeah, most people don't go for that. So Some do, some donate their bodies to
Yeah.
science. And
We got our bodies going for that.
Does anybody else have any questions, or should she start the testing?
Testing.
Testing, we're all
1, 2, 3.
anxiously awaiting.